Over 60? Just one common pill you take each morning could raise your risk of heart failure by 1% every single day. And you probably haven't even been warned about it. We tend to picture heart attacks as sudden, dramatic moments. But what if the real danger isn't loud? What if it's a slow leak, weakening your heart cell by cell, day after day, while you take your morning pills? I used to believe every prescription was protecting me, until I met Helen, 73 years old, sharp as a tack. She walked every morning, cooked her own meals, and never smoked. Then, one night, she collapsed quietly watching television. Her cardiologist later traced the damage back to a medication she'd been taking for 5 years. A medication meant to help her. That woke me up. The National Institute on Aging says most of us over 60 take at least 5 prescription drugs daily, but some of them, even common ones for blood pressure or cholesterol, have a quiet side effect. They don't cause pain. They cause slow decay in your heart's ability to beat strongly. That's why I'm sharing the truth today. 5 medications that may be silently robbing your heart of its strength. I'll also show you how to spot the warning signs and, later, reveal a powerful way to bring this up with your doctor confidently. If this video made you pause and think, then please like it, subscribe to my channel, Golden Aging Health, and hit the bell. Your heart deserves more than silent damage. It deserves to be heard. This video is for informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your healthcare provider before making changes to any prescribed medications. Medication number 1. Diabetes Drive UGS. Let's start with something that often gets missed some. Diabetes medications can quietly damage the heart, especially in people over 60. These drugs are called thiazolidinediones, or TZDs. You might know them as pioglitazone or rosiglitazone. Doctors prescribe them to help control blood sugar in type 2 diabetes by helping the body use insulin better. And while that sounds helpful, it can come with serious heart risks for older adults. The American Heart Association warns that these medications can cause your body to hold on to too much fluid. For seniors, that extra fluid makes the heart work harder than it should. Over time, this pressure can wear out the heart muscle, leading to heart failure or making an existing heart condition worse. I've seen this happen up close. My neighbor James, a proud 68-year-old who kept himself active, began experiencing unexplained fatigue and swelling in his lower legs shortly after starting a new diabetes medication. He gained over 10 pounds in less than a month, despite no change in his diet. He brushed it off as aging until his breathing became labored, and he was diagnosed with early-stage heart failure. Talk to your doctor about the medications you're using, especially if pioglitazone or rosiglitazone is part of your treatment. Ask directly whether your heart is being monitored and whether this medication is the best choice for someone your age. There may be safer alternatives that protect both your blood sugar and your heart. And please stay with me. One of the most surprising threats to senior heart health is still ahead. It's a drug many people take daily, believing it's protective, but research now shows it might be quietly damaging the heart. Medication number 2, the cold medicine. It's sitting quietly in your medicine cabinet, a tiny pill you take when your nose gets stuffy or your sinuses feel blocked. It doesn't feel powerful. It doesn't come with any warnings on national news, but for seniors, this everyday cold medicine can quietly hijack your heart. I'm talking about decongestants containing pseudoephedrine or phenylephrine netha, ones found in dozens of over-the-counter flu and allergy medications. Most of us have taken them for years without giving them a second thought. But as we age, our hearts change, and what once felt harmless may now carry serious risks. Doctors at the Mayo Clinic have confirmed that pseudoephedrine can increase heart rate and trigger angina, especially in older adults with underlying heart disease. And yet, these pills remain available without a prescription, offered as quick relief, with little mention of the cardiovascular cost. I once met Margaret, a retired school teacher in her 70s. She caught a mild cold, took a standard decongestant, and spent that night pacing her living room with her hand on her chest. Her heart was racing. Her blood pressure had spiked to levels that required emergency care. All from a medicine she thought was safe. This is the kind of small decision that can lead to big consequences. Before reaching for anything that says nasal relief, check the label. Look for pseudoephedrine or phenylephrine, and if you've ever had heart issues, ask your doctor or pharmacist for a gentler option. And if this video is helping you see the hidden dangers in everyday meds, don't forget to like it. A single click helps this message reach thousands of other seniors who need it just as much as you do. Medication number 3: NSAIDs, for example, ibuprofen, naproxen. For many older adults, joint pain is a daily companion. Aching knees, stiff hips, sore backs, we reach for relief so often it becomes part of the routine. But one group of pain relievers, used regularly by millions of seniors, can quietly place enormous strain on the heart. These are NSAIDs, or non-steroidal anti-inflammatory drugs. Common names include ibuprofen and naproxen, sold as Advil, Motrin, Aleve, and many others. While they reduce inflammation and help with arthritis pain, they also come with hidden cardiovascular risk, especially for people over 60. I once met Robert, a 75-year-old grandfather who prided himself on staying active. Every morning, he'd take naproxen to keep his hip pain in check so he could keep up with his grandkids at the park. But over time, he began to notice something wasn't right. Walking short distances left him winded, and his shoes felt tighter than usual. At first, he blamed the weather or age. But after a checkup, his doctor found fluid buildup and elevated blood pressure. It turned out the very medication helping his joints had been quietly straining his heart for years. According to both Harvard Health and the National Institute on Aging, seniors who take NSAIDs frequently face a significantly increased risk of heart complications, especially if they already have high blood pressure. NSAIDs interfere with how the kidneys regulate salt and water. This can cause fluid to build up in the body, increasing blood pressure. What makes these effects so dangerous is how quietly they develop. No chest pain, no warning signs, just a bit more fatigue. Have you ever experienced anything like this while using NSAIDs regularly? Tell me in the comments. It might help someone realize what their body's been trying to say. Doctors often recommend switching to acetaminophen for safer pain relief, but only under medical supervision. As we age, even everyday medications need to be reevaluated with our hearts in mind. Coming up, I'll explain how one common blood pressure drug often seen as heart protective may slowly weaken your heart's rhythm when taken long-term. This one might surprise you. Medication number 4, antiarrhythmic meds, amiodarone. Let me tell you about Linda, a retired nurse in her early 70s. She was diagnosed with atrial fibrillation, a common type of irregular heartbeat, and her doctor prescribed a medication called Amiodarone. At first, it was life-changing. Her heartbeat became steady, her energy returned, and things felt under control again. But over time, she noticed a strange cough that wouldn't go away, a heavy feeling in her chest, and fatigue that crept in slowly. Later tests showed damage not just to her lungs, but to her thyroid and heart function as well. Stories like Linda's are more common than many realize. Amiodarone is part of a group of antiarrhythmic drugs used to manage abnormal heart rhythms, particularly atrial fibrillation. It can be highly effective, especially during the early phase of treatment, but long-term use, particularly in older adults, carries a serious risk of toxicity that may affect multiple organs, including the heart itself. Research published by Harvard Health and the Journal of the American Geriatric Society highlights that many of these side effects progress silently. There may be no early symptoms, even as heart function slowly declines. To stay ahead of these complications, regular blood tests and EKGs are essential. They help track subtle changes that you can't feel but could become serious over time. After this video, consider making a list of all your current medications and bring it to your next appointment. Ask your doctor whether any of them, like Amiodarone, require extra monitoring or updated tests. In our final section, I'll reveal one of the most prescribed medications for seniors, often praised for heart protection, but recent studies show it could weaken the heart muscle over time. Medication number 5. Calcium channel blockers, especially in high doses. This last medication often catches people off guard because it's usually prescribed to protect the heart. That's what makes it so tricky. Calcium channel blockers, like verapamil and diltiazem, are often given to older adults to manage high blood pressure or certain heart rhythm issues. On paper, they look like heroes. They relax blood vessels, reduce heart rate, and help control chest pain. Many seniors have been on them for years without question. But here's what most people don't realize. At higher doses, or after long-term use, these medications can slow the heart down too much. And that's when protection quietly turns into pressure. The American Heart Association notes that calcium channel blockers can reduce the force of the heart's contractions and may interfere with the electrical signals that keep the heart beating at the right pace. This can lead to something called heart block, where the signals don't travel properly, and that causes fatigue, dizziness, and even fainting spells. I remember speaking with a gentleman named Richard, 74, who had been feeling slower and more winded lately. He blamed it on age. But an EKG revealed his heart rate had dropped into the 40s. His medication dose, unchanged for years, was now quietly suppressing his heart's rhythm. Watch for signs like an unusually slow pulse, lightheadedness when standing, or shortness of breath during light activity. These could be your heart's way of asking for help. Have you or someone you care about ever felt unexpectedly sluggish or dizzy while on blood pressure meds? Let's talk about it in the comments. Let's take a moment to bring it all together. Today, we uncovered 5 common medications that may quietly weaken the heart, especially after age 60. From diabetes drugs that cause fluid buildup, to cold medicines that raise your blood pressure, to antiarrhythmic drugs like amiodarone, pain relievers like NSAIDs, and even calcium channel blockers that can slow your heart too much. Each of these medications has its place. They're not bad, but when taken for too long, at the wrong dose, or without proper monitoring, they can slowly strain a heart that's already working hard with age. But here's the good news. Knowledge gives you power. By asking the right questions, paying attention to subtle symptoms, and reviewing your prescriptions regularly, you can stay in control of your heart health without fear. You don't have to do it alone. Take what you've learned today and bring it to your next appointment. Print your medication list, bring a loved one with you, and talk openly with your doctor. Even small changes can protect your heart and add strength to your years. If this video helped you see things differently, click the like button to support this message. Subscribe to my channel, Golden Aging Health, for weekly advice tailored for adults over 60. And don't forget to hit the bell so you never miss a life-saving tip.